Hello, everyone. My name is Casey Belter. I am a student at Concordia University, and this is a policy brief on the Minnesota Senate Bill 1994. My policy topic is minor consent for HPV vaccination authorization. This is a very controversial topic due to the ethical issues that play a role. This bill has not yet been passed, and there are many groups that are opposed to it due to the ethical dilemmas involved. Ultimately, the passing of this bill would allow minors to consent for the HPV vaccination without their parents' consent. Understandably, there is much concern regarding parental lack of knowledge related to their child's medical history and vaccination record. There are also privacy concerns, role conflict, and much hesitancy from political groups and religious groups. Regardless of the ethical issues, this bill could ultimately reduce the prevalence of HPV by eliminating a barrier to accessing the vaccination. There is much research and strong evidence that the HPV vaccination is an effective intervention against HPV and is recommended by the CDC between the ages of 11 and 12. The idea is to increase the knowledge of all parties involved on the statistics of the prevalence of the disease and how this bill could affect that if it were passed. Therefore, I am in support of this bill. The issue is the HPV vaccine protects from most of the cancers caused by human papillomavirus infection. Currently, parental consent is needed. There are many ethical issues concerning this topic related to whether parents or guardians should be informed and required to consent to this vaccination, or if the minor should be allowed to choose the vaccination without parental consent. The idea is to protect adolescents from the virus who are concerned about discussing the topic with parents or guardians due to the nature of the topic. Many parents believe they should be involved in the decision, and there's much controversy on the topic. Some background and history. HPV is a very common virus that spreads between people when they have sexual contact with another person. According to the Center for Disease Control and Prevention, about 14 million people, including teens, become infected with HPV each year. HPV infection can cause cervical, vaginal, and vulvar cancers in women and penile cancers in men. HPV can also cause anal cancer, throat cancer, and genital warts in both men and women. According to the National Cancer Institute, HPV is the most common sexually transmitted infection in the United States, and more than 80% of sexually active individuals will become infected with at least one type of HPV in their life. The HPV vaccine has been shown to produce a higher immune response in preteens compared to older adolescents, and the recommended age to receive the vaccine for boys and girls is age 11 to 12. The idea is to protect them before ever being exposed or before sexual activity. The HPV vaccination is given in a series of 3 injections over a 6-month period. The vaccinations are typically covered by insurance and somewhere around $125 per dose. Some related bills in other states. So first off, every state has laws allowing for minors to consent to STI services, with some states requiring the minor to be of a certain age, which is typically 12 to 14 years old. California passed a law for minors to consent for HPV vaccination in 2012. There was an outpouring of disapproval from various groups. Legislators met resistance and were highly criticized from certain groups such as parents, religious organizations, and opposing politicians. The law expanded the legal authority of minors 12 years and older to consent to confidential medical services for the prevention of sexually transmitted diseases without their parents' consent. The services included hepatitis B vaccination, HPV vaccination, HIV pre- and post-exposure medications, and additional STD prevention services that may become available in the future. There is also a bill in the New York State Assembly that would allow minors to consent for administration of the HPV vaccine. There is also much debate on whether or not to require boys and girls to be vaccinated against the HPV. And the actions that have been taken. It was introduced by Senators Klein, Marty, Rest, Wickland, and Diedzik. Related bills are the Senate Bill 1129, House Bill 2379, and House Bill 2469. All would allow minors to consent for HPV vaccination. Some major actions. The bill was first read and introduced on March 9th, 2017. That same day, the bill was referred to Health and Human Services, Finance, and Policy. Nothing further has been done with this bill since then. some unintended consequences. There's opposition due to the ethical issues, criticism from certain groups such as parents, religious organizations, and opposing politicians. This creates a possible breach in patient-physician confidentiality when physicians are obligated to provide vaccination records or bill for services provided, revealing the reason for the visit and the services provided. Further need for privacy assurance, such as medical records available to parents and billing. Stakeholders. Public health officials are the biggest stakeholders supporting minor consent authorization. There was not strong statistics or clear sides listed under any organization's website. However, these were the groups recommending following the guidelines for the vaccination schedules, emphasizing statistics from the CDC, and strongly recommending preventive intervention through vaccination. These groups included the American Cancer Society, the Kaiser Family Foundation, Minnesota Department of Health, and the National Cervical Cancer Coalition. The strongest opposing stakeholders were thought to be some conservative legislators and religious groups. The biggest concern all around was parents wanting to be informed of their children's medical history and fear of encouraging sexual promiscuity. Recommendation. As a future advanced practice registered nurse, I support the passing of the Senate Bill 1994 for human papillomavirus vaccinations minor consent authorization. With the CDC recommendation of boys and girls being vaccinated between the ages of 11 and 12 years old, I believe the minor consent authorization can reduce the occurrence of declined vaccinations due to parental refusal related to the lack of knowledge of the minor's sexual history and the need for the vaccine. The minor can consent to the vaccine and prevent HPV without the concern of repercussions from a parent. With cervical cancer being the second leading cancer killer of women worldwide, I strongly support everyone being vaccinated prior to becoming sexually active. Authorizing minor consent for the HPV vaccine would eliminate a barrier to prevention of the disease. While understanding the concerns of parents and their disapproval of not being informed of their child's vaccinations or complete medical history, I am supportive of any steps that can be taken to reduce the prevalence of HPV and rates of cervical cancer. The CDC in 2017 estimates that nearly 80 million people in the United States, or about 1 in 4, are currently infected with HPV. HPV vaccination provides safe, effective, and lasting protection against the HPV infections that most commonly cause cancer. As healthcare providers, we need to advocate for our patients and take all the necessary steps to reduce the barriers and improve patient outcomes. This bill can remove one of the barriers to patients' access to care, decrease the prevalence of HPV, and ultimately reduce cervical cancer and death. Here are some references used in this presentation, and thank you for watching.